increasing awareness on the part of WOCN leadership that there's a tremendous gap and disparity between ostomy care needs and the availability of certified ostomy care nurses.
It's an access to care issue, isn't it? I think the society leadership has seen that there is a problem for our ostomy patients accessing care along the continuum. And I also believe that our patients are more savvy now. They're looking for access to care. They understand what they should get when they have surgery, and having someone who can teach them how to manage their stoma, how to prevent complications, how to utilize the right products is really key. And I think that many of these are the reasons that WOCN leadership said it's time for us to have an ostomy program for care associates.
I think that a lot of times certified ostomy care nurses, WOC nurses have concerns that when we develop additional educational programs that maybe those people will represent competition to them, and maybe those individuals as possibly replacing the certified wound ostomy continence nurse, and that's not the intent of these programs at all. That was a big concern when we developed the WTA program, and that has not proven to be the case. We have been able to show that, number one, WTAs act as WOC nurse extenders, that many people who start out in the WTA program actually end up going back to school because they decide they want to be a WOC nurse.
These providers will now have some information to do some problem solving until they can refer to the WOC nurse if in fact they have it. So I think it can facilitate the patient's flow through the system. I think they'll be able to make the discharge plans the way that they think they should. I think that's really important as well. But you know, what's really important nowadays is patient satisfaction. And we track patient satisfaction through the hospital. And I know that patients have said to me before, I wish you were here on Friday because I really had a problem and yet you weren't here. Well, that'll take care of it. We'll have an OCA who will be there and be able to say, okay, let me figure out what's going on, perhaps problem solve, or maybe not be able to problem solve, but know enough that they would then refer to a WOC nurse. So I think it will really help the facility in providing more well-rounded care.
And I also look at agencies that are very concerned about their bottom line financially. If a patient gets home and they don't know what to do, they get into trouble, they don't know what to do, there's no ostomy expertise available from their home care provider, they don't know anyone to call, they call back and they can't get one of us, you know what they do? They go to the emergency department. They go to the emergency department because they're out of supplies, because they're scared and they don't know what this means. I see this, what does this mean? That's a very expensive care setting. You don't want patients going to the emergency department for visits to get supplies.
And you're right, the hospital really doesn't get reimbursed for that because
No.
that falls within that global period. So the hospital actually is not going to get reimbursed for it, but it's going to be extremely costly for them as well. So when CWOC nurses are considering bringing this program into the facility, I think they need to sit down and think about the benefit to the institution and when they're talking to management. And I think there's several points that they can bring up. First of all, I believe with shortened length of stay, getting our patients to move through their stay and achieve all their objectives in a short period of time is huge. I think that speaks certainly to administration. They understand now that they need to be moving patients through the facility as quickly as possible, but not forgetting that the patient needs to meet their needs. So I think that's one issue. I think another issue is, as we spoke about before, is readmission rate. We need to think about, just because we do have our patients with a short stay and they get in and out in a short period of time, are they going to make it at home? Do they have the skills they need so they don't have complications? They're not going to show up to the ER, they're not coming to the outpatient clinic dehydrated and going to infusion labs and getting fluids. It's really important for administration to know that they have nurses who have the skills they need, are satisfied with their job and are doing a good job, and then patient satisfaction is important as well.